Doctor, does bypass last long life?
So you want to ask basically whether a bypass lasts for life?
Yeah.
Yeah, obviously. So you know what we do in bypass, right? So during bypass, what we do is we cut this bone, we reach the heart, okay, and we see the coronaries.
Okay.
And depending on how bad the lesions are, we either use the arteries from inside the chest. There are two arteries inside the chest, or the artery from the hand, or the arteries or the veins from the leg, rather. Okay, and we use these to bypass. Now, because these are the patient's own blood vessels, they last for life.
Okay.
Unlike, say, during stenting, we put foreign substances inside, which come with a limited shelf life because they are obviously foreign to our system. So in bypass, because we use the own blood vessels of the patients, they have no rejection and they last for life.
Okay. Sir, can progress disease?
Disease progression, that's what you want to know. Even after a bypass, yes. See, disease progression is based on certain factors. Most important is most of our patients are diabetes these days. So if the diabetes is not under control, the sugars are very high, HbA1c is more than 10, or if the patient continues to smoke, drink, continues addiction. I mean, I've seen quite a few patients who have done very well after a bypass and then they get back to their old habits. Obviously, this is not good. Alcohol in any form, as we all know, is bad for the heart. And smoking, obviously, again will give rise to those calcium deposits all over the body, not just the coronaries. So these are the other factors which have to be controlled, and these are important determinants of the lifelong patency of the drugs. But all said and done, still there are certain patients in which we cannot give blood thinners and who have started bleeding after giving high dose of blood thinners. If a bypass is done in such patients, still the bypass drugs keep flowing, and that is the beauty of a bypass. Thank you.
Thank you, sir.